Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Sinise. We meet every Saturday at 10:30 a.m. Central Time. And if you're watching us live, we're on YouTube and Facebook Live every week. And you can always watch our on demand by going to our UroPatient.com website, where you'll find all of our past episodes. Also, the best place to go to get any of our handouts. We've got a bunch of them, so go and check those out. Every program I put out, I have a handout with valuable information for you guys. So let's get started with our show this week. So here we are, kicking off year number 2. And I thought I'd talk to you about a disease that's not as common, maybe you haven't heard of it, called Peyronie's disease. We're going to talk about its causes, symptoms, and treatment options. And as you can see from our cute little monkey there holding that curved banana, the companies that treat this often use fruit or vegetables that kind of curve to kind of demonstrate what the curvature of the erection looks like. So I decided I'd steal that idea with the banana. But the curved erection, one that's not straight and probably not usable because of that, is what Peyronie's disease is. So we'll talk a little bit more about that. Now, Peyronie's disease affects about 1 in 10 men. Scar tissue under the skin causes curvature, making sexual activity difficult. And that's the kind of the key. Now, this was discovered by Francois Gigot de la Peyroine, where it got its name. He was a renowned French surgeon, best known for describing Peyronie's disease, the condition characterized by fibrous plaque formation in the penis that causes and leads to this curvature and erectile dysfunction. He was the royal surgeon to King Louis XV and founder of the Royal Academy of Surgery in Paris. He played a pivotal role in advancing surgical practices in the 18th century France. His contributions extended beyond urology to various surgical innovations and improvements in medical education, establishing him as a key figure in the history of surgery. Kind of an interesting guy. So while injury is the common cause, many cases can occur without any noticeable trauma. We think genetics, aging can be some of the key factors in its cause. Symptoms range from mild curvature to significant deformity and erectile dysfunction. Pain often subsides, but the curvature may remain. So this is something you might notice after, kind of a rough intercourse and some penile injury that could cause that. So curvature of the penis can be classified as congenital or acquired. So 2 different types. Congenital curvature occurs due to uneven development of the penile tissues and is present from birth, typically without associated scar tissue. Acquired, which is what we see mostly, is curvature caused by the Peyronie's disease, where fibrous plaques develop leading to bending during the erection. The curvature can be upwards, downwards, sideways, depending on the location of the plaque. So the plaque is kind of a hard spot, and it doesn't allow the erectile bodies to stretch completely, and it causes that weird bending. A mild upward curve of the penis when erect is considered normal. So just keep that in mind. Some men will come in saying, I've got some curvature here, but they're not having difficulty with intercourse, and a little bit of a curvature is considered normal and common among men. However, if the curvature starts to exceed 20 to 30 degrees, and I'll show you how that's measured in a moment, and causes pain, that's a key factor, or interferes with sexual function, medical evaluation is recommended. And we kind of see that we have these things that we can measure the curvature. Now, here's what we measure. So you can see that plaque formation, that thing right there, that's the plaque, is causing the penis to bend slightly. Now, 15 degrees, that probably isn't going to cause too many issues with intercourse. But as it starts to get to be more pronounced, it may. So this is a little worse, 30 degrees. And you can see we kind of measure that angle right there. You have to measure the penis when it's erect. So a lot of times what we'll have patients do is take pictures of their erection and bring that in. Then I can put a little meter on it and measure the actual curve, just like you measured curves in math class with the protractor. Very similar. So 30 degrees, probably starting to get a little more significant, may cause some issues. And then you can see this next slide, the 60 degree and the 90 degree. 90 degree, it's like a hockey stick almost. It's bent over. patients with 90 degrees probably are going to not be able to have intercourse because of the severe bend. If they do, it's going to be very difficult and probably painful. So those are the ones that definitely you want to treat. And even at 60 degrees, it may be difficult. But we do see some of those. And again, these are all showing bending upwards, but it can bend sideways. It can bend downwards. So it kind of varies. And again, you'll notice this on erection. Diagnosis involves medical history, a physical exam. Sometimes we do ultrasound to look at tissue damage, like try to see if we can see that plaque, and maybe even some blood flow studies to see if there's a decrease in blood flow. But mostly it's the history and the physical exam. You can palpate or feel, fancy word for feel, these little fibrous things pretty easily. Now, treatments vary depending on how severe it is. Traction devices and injections help reduce the curvature, while in really severe cases, we do surgery to remove that plaque. I can tell you that nowadays we don't do too many surgical procedures because the latest injections called Xiaflex has really worked. We've done a bunch of things in the past to try to break up these plaques. Xiaflex has been the most successful. And this other one I'm going to talk to you about is called the penile traction device. It's called Restorex, and it's really kind of a also another device you can use to get some really good results. This is what it looks like. It's Restorex treatment is completed in 2 30-minute treatments per day in the comfort and privacy of your own home. So a little kind of video we'll watch real quick here.
Begin with Restorex pulled all the way back toward the pelvic ring on both the extension rods and tension rods. Place your penis through the pelvic ring and onto the open clamp. Slowly and gently close the clamp. Continue to close until it is tight enough to be secure, but at the same time can be worn comfortably.
Now that wrap you see around the penis, they include that.
Pull Restorex back on the tension.
It just kind of helps the hold get a better grip.
Slowly and gently release the springs.
This is not painful, by the way.
Holding the pelvic ring against your body with one hand. Lengthen Restorex by pushing it along the extension rods one notch at a time until the white bands on each tension rod can no longer be seen.
So pretty simple to use. Again, 2 30-minute treatments per day in the comfort and privacy of your own home. Now, I'd mentioned that there's an injection that we use called Xiaflex. It's a small injection. You come into the office, we inject right into that plaque, and it causes the plaque to start to break up and become soft. So it's really done a big, big difference in helping to fix this problem. The injection is a very tiny needle. It's a little discomfort. It's not severe pain. You don't have to be put to sleep or anything for it. Again, some of these procedures we just do right in the office. Now, interestingly, I just recently had the guy who invented the Restorex device on my show for UroNurse. And if you want to check that out, you can go check uronurse.com out to see that one. But he was saying that right now they found that the combination of using the Xiaflex and the Restorex devices, he had the best results. So maybe a combination treatment is going to be in the future for people. So keep that in mind. Now, emotional support is essential. We want to encourage men to seek help early for better outcomes and reduced emotional impact. This can really be a tough thing, for guys. It's if suddenly your penis isn't working and you don't know that there's things that can be done to fix it. Preventing Peyronie's disease is really key. It involves minimizing some risk factors associated with penile trauma and maintaining overall health. Key prevention strategies include avoiding penile injury. So practice safe sexual techniques. There's certain positions that, the woman can kind of be grinding down on the penis and inadvertently it slips out and bends it. We'll talk about that someday. There's actually a disease, or not a disease, but a process where you can have what we call a fractured penis, where actually you'll rupture through the actual corporal bodies, and it's kind of considered a medical emergency. It needs to be fixed. Some of those can cause these Peyronie's afterwards. Always use adequate lubrication and avoid rough, forceful sexual activity to reduce the risk of trauma. Manage other health conditions like diabetes, high blood pressure, and high cholesterol, as they may contribute to vascular issues linked with Peyronie's. Quitting smoking and limiting alcohol both can impair blood flow and tissue healing. Regular exercise and healthy diet. Maintaining a healthy lifestyle supports vascular health and tissue repair. And again, early medical attention. Seek prompted medical advice if you experience penile injury, swelling, or early signs of curvature, as early treatment may prevent progression. Thanks for watching. Remember, Peyronie's is manageable with care. Early diagnosis improves the outcome. Be sure to talk to your healthcare provider if you have any concerns. So I hope you enjoyed that episode. It really was one of these areas I think we don't talk about enough. And like I said, when I was talking about my 1-year anniversary slides, and I was saying there's always something else to talk about. So we'll be around for a while with more information for you guys. So I'll get a little handout in there for you too on Peyronie's disease too, to make it something that you can download. But we'll see everybody next week. Have a great week, and we'll see everybody. Oops. And we'll see everybody again next week.